with Matters Health. And as doctors officially begin their much-anticipated nationwide strike, thousands of patients who visited various health facilities to access medical services have been left in agony. However, at the same time, some hospitals continued with the normal operations. Our reporter, Elizabeth Atieno, now paints a picture on exactly how this strike has crippled delivery of health services across the country.
Kenya's health sector is currently hanging in the balance as patients face hurdles accessing health services due to the doctors' strike that commenced on Thursday midnight. This was the situation at Coast General Hospital in Mombasa County. Hundreds of patients flocked the facility to access health services, but their efforts bore no fruits, with no doctor to treat them. On the other hand, doctors have found themselves in a state of dilemma as they opt to fight for the rights of medical interns.
Doctors here right now are stretching. They are doing not even 12 hours, others are doing 24 hours. Madaktari wengine kaunti zingine hata hawana off. Watu wanafanya tu kama kawaida.
A similar situation was witnessed at Meru Level 5 Hospital. Here, we find hundreds of patients thrown in a state of despair as they sought treatment which was not available. And as time went by, some patients were forced to leave the facility and seek services at private hospitals. One woman informs us she is battling anxiety, not knowing the fate of her ailing husband who was scheduled to have his surgery today.
Nilikuwa na mgonjwa ambaye ni bwanangu. Tulikuwa tumeambiwa tukuje admission aende theater kesho. Jana wakatupigia simu wakatueleza tukuje leo. Kufika wanatuambia hawawezi mhudumia leo because daktari wako on strike.
At the Bungoma Referral Hospital, a fleet of motorbikes are spotted at the main gate with cyclists waiting for patients to ferry. But for today, there are no passengers, a clear indication of the disrupted services at the facility.
Kama Bungoma County Referral Hospital, tuko na madaktari 37, but leo hivi ni madaktari 11 peke yake wameweza kufika kazini.
At Kiambu Level 5, nurses and clinicians have been left with the responsibility of looking after patients who visit the facility for the better part of Thursday as doctors failed to turn up. Kiambu County Health CEC Elias Maina has expressed his concern on the strike, recounting how a patient in dire need of emergency services was left in agony, forcing him to recall the doctor in charge of the department.
Doctors have kept away from work today. Therefore, we have scaled down on the services that we are offering.
However, a sharp contrast was witnessed in Nairobi County, where a spot check conducted by TV47 shows how some public health facilities went about their normal operations. For instance, at Magathi Hospital, patients flocked the facilities as doctors pitched tent ready to treat the patients.
The strike was announced, then that court order was released a bit late. So perhaps those who are not or have not reported, most probably is because of that confusion.
The situation was not any different at Mama Lucy and Kenyatta National Hospital, where we spotted a long queue of patients who were able to access health services. As the push and pull between the Doctors' Union and the Ministry of Health intensifies, the worst hit are thousands of Kenyans in dire need of health services, as many amplify their voices to call for dialogue to tame the situation. Elizabeth Atieno, TV 40.